Every morning brings with it a new beginning, a chance for fresh starts, new goals, and hopeful possibilities. But for millions of men, those early hours can also bring subtle warnings that something deeper may be brewing beneath the surface. Imagine waking up and noticing a change. Maybe it's a little more difficult to start your day, or perhaps there's a discomfort that wasn't there before. These small signals, often brushed aside as ordinary signs of aging, could be early warnings of something far more serious: prostate cancer. In the silent hours before the world awakens, your body may be trying to tell you something important. Today, we'll uncover the 5 early morning signs of prostate cancer that you should never ignore. Understanding these signs could make all the difference in safeguarding your health, your future, and your peace of mind. For many men, prostate cancer is a distant concern, something that happens to other people. But the truth is, it's one of the most common cancers among men worldwide. According to the American Cancer Society, about 1 in 8 men will be diagnosed with prostate cancer in their lifetime. The good news? When detected early, prostate cancer is highly treatable. The challenge? Its initial symptoms are often subtle, creeping into your routine quietly, especially in those silent morning hours. Let's face it, most of us are not eager to talk about our health, especially when it comes to issues down there. It's easy to dismiss discomforts as part of getting older, or as a result of yesterday's activities. But what if those little changes are actually your body's way of sounding an alarm bell? By the time prostate cancer shows obvious symptoms, it may already be more advanced. That's why recognizing the early signs, especially those that appear in the morning, can be life-saving. So, what should you be looking out for? Let's dive into the 5 early morning signs of prostate cancer, breaking down why they matter, how they might manifest, and what you can do if you notice them. The first sign is frequent urination, especially at night and early morning hours. For many men, waking up once or twice to use the bathroom isn't unusual. But if you find yourself getting up multiple times, struggling to get a good night's sleep because of the constant urge to urinate, it could be more than just a full bladder. The prostate gland sits just below the bladder and surrounds the urethra, the tube that carries urine out of the body. As the prostate enlarges, it can press against the urethra, making it difficult for urine to pass. This pressure is often most noticeable at night and in the early morning, when your body's position and relaxation highlight the problem. If you notice a sudden change in your pattern, waking up more often, feeling a stronger or more urgent need to urinate, or finding it harder to fully empty your bladder, it's time to pay attention. Don't brush it off as just getting older. These could be early signs that your prostate is trying to tell you something's wrong. The second early morning sign is pain or discomfort in the pelvic area. You might wake up in the morning with a dull ache or pressure around your lower abdomen, pelvis, or even lower back. It's easy to attribute this to sleeping in a strange position, an old injury, or just general soreness. But when the pain is persistent, especially if it's coupled with urinary changes, it could signal inflammation or growth in the prostate gland. This discomfort is often subtle at first, a nagging sensation that comes and goes. It may be worse after lying down all night and then easing once you've moved around. If you find yourself starting your day with unexplained pelvic pain, don't ignore it, especially if it's accompanied by other symptoms. Your body is sending you a message, and it's crucial to listen. The third sign is blood in the urine or semen, a symptom that can be particularly alarming. It's not something most men expect, and spotting blood, whether it's a pinkish tinge or a deeper red, can be frightening. This symptom is often most noticeable in the morning, when you first visit the bathroom after several hours of not urinating. Blood in the urine can be caused by a number of conditions, but when paired with other prostate symptoms, it's a definite red flag. It's not something to ignore or hope will go away on its own. Even small amounts of blood should prompt a conversation with your doctor. Early detection is key, and catching this sign early can make a huge difference in treatment outcomes. The fourth early morning sign is difficulty starting or stopping urination. Imagine waking up, standing at the toilet, and finding that it's harder to get the stream going, or that it stops and starts unexpectedly. For many men, this is brushed aside as a minor inconvenience. But in reality, it's a sign that the prostate may be obstructing the urethra, making normal urination difficult. You might notice hesitancy, a weak stream, or dribbling after you think you've finished. Over time, these changes can become more pronounced, interfering with your morning routine and affecting your quality of life. If you notice these changes, don't just chalk it up to age. It could be an early indication of prostate cancer or another serious prostate condition. The fifth and final sign is unexplained fatigue or malaise in the morning. You might wake up feeling unusually tired, even after a full night's sleep. This isn't just about being groggy or not getting enough rest. It's a deeper, more pervasive sense of fatigue. Prostate cancer, like many cancers, can cause systemic changes in your body, leading to feelings of weakness, low energy, and general malaise. This symptom is often overlooked, attributed to stress, poor sleep, or a busy lifestyle. But when it's persistent and combined with other warning signs, it's time to take notice. Unexplained fatigue is your body's way of signaling that something is off, and it deserves your attention. So, what can you do if you notice one or more of these early morning signs? First and foremost, don't panic. Many of these symptoms can be caused by benign conditions, like an enlarged prostate, benign prostatic hyperplasia, or urinary tract infections. But they can also be early indicators of prostate cancer. The key is not to ignore them. Here's what you need to remember. Early detection saves lives. If you notice changes in your urinary habits, pelvic discomfort, blood in your urine or semen, difficulty with urination, or unexplained fatigue, make an appointment with your healthcare provider. Be honest and thorough about your symptoms, even if they seem minor or embarrassing. Your doctor can perform simple tests, such as a digital rectal exam or a prostate-specific antigen PSA blood test, to assess your risk and determine the next steps. It's also important to understand the risk factors for prostate cancer. Age is a significant factor. Most cases are diagnosed in men over 50, and the risk increases with age. Family history plays a role as well. If your father or brother has had prostate cancer, your risk is higher. Ethnicity matters too. African American men are at greater risk and tend to develop more aggressive forms of the disease. Lifestyle factors, such as diet, exercise, and overall health, can also influence your risk. Taking charge of your health starts with awareness. Don't wait for symptoms to become severe before you act. Regular checkups, honest conversations with your doctor, and a proactive approach to your well-being can help catch prostate cancer early when it's most treatable. Let's take a moment to talk about the emotional impact of these symptoms. Many men feel isolated or embarrassed when they experience urinary or sexual health issues. It's common to feel anxious, worried, or even ashamed. But you are not alone. Millions of men face these challenges, and talking openly about your symptoms is a sign of strength, not weakness. Seeking help early can not only improve your physical health, but also support your mental and emotional well-being. If you're watching this and thinking, those symptoms sound familiar, don't hesitate. Reach out to your healthcare provider. There is no shame in prioritizing your health. Remember, prostate cancer caught in its earliest stages is highly treatable, and many men go on to live full, healthy lives after diagnosis and treatment. Let's recap the 5 early morning signs of prostate cancer. First, frequent urination, especially at night and in the early morning. If you're waking up multiple times, struggling to empty your bladder, or feeling a constant urge, take note. Second, pelvic pain or discomfort. Persistent aches or pressure in your lower abdomen, pelvis, or back, especially if it's worse in the morning, deserves attention. Third, blood in your urine or semen. Any sign of blood, no matter how small, should be checked by a doctor. Fourth, difficulty starting or stopping urination. Hesitancy, weak stream, or dribbling are all warning signs. Fifth, unexplained fatigue or malaise. Waking up tired despite a full night's sleep could be a sign that your body is fighting something deeper. Each of these symptoms can be caused by other conditions, but together they form a pattern that should not be ignored. Your health is your most valuable asset, and taking action now can make all the difference. So, what can you do today to protect your prostate health? First, schedule regular checkups with your doctor, especially if you're over 50 or have a family history of prostate cancer. Don't be afraid to discuss any changes you've noticed, no matter how minor they seem. Early intervention is key. Second, maintain a healthy lifestyle. A balanced diet rich in fruits, vegetables, whole grains, and lean proteins can support prostate health. Regular exercise, maintaining a healthy weight, and avoiding smoking or excessive alcohol can also reduce your risk. Third, Educate yourself and the men around you. Share this information with friends, family, and loved ones. Breaking the silence around prostate health can empower more men to seek help early and take control of their well-being. Finally, remember that prioritizing your health is an act of self-care and love for yourself and those who care about you. Don't let embarrassment or fear hold you back from taking action. Your future self will thank you. As we close, I want you to imagine waking up tomorrow morning feeling confident and secure in your health. Imagine the peace of mind that comes from knowing you're paying attention to your body's signals, taking proactive steps, and making informed choices. That's the power you hold, right now, today. If you found this information helpful, take a moment to reflect on your own health and consider sharing these signs with someone you care about. Awareness is the first step toward prevention, and together we can make a difference. Remember, your health matters. Your mornings matter. Listen to your body, act early, and prioritize your well-being. Thank you for taking the time to learn about the 5 early morning signs of prostate cancer. Stay informed, stay proactive, and take care of yourself. Because every morning is a new chance for a healthier, brighter future. If you're looking for more information on men's health, prostate cancer, or early detection, don't hesitate to reach out to your healthcare provider or explore reputable resources online. Knowledge is power, and you deserve to have all the facts. Thank you for joining today's important discussion. If you have questions, share them with your doctor or start a conversation with those around you. Your voice matters, and your actions today can lead to a healthier tomorrow. Stay well, stay aware, and remember, you are not alone on this journey. Every morning is a new opportunity to listen, learn, and take action for your health.